everyone and welcome to Exclusively Equine Veterinary Services. Today I was wanting to answer a question regarding intravenous and intramuscular injections in the horse, how to give them and where to give them. So the first thing I thought I would do on this beautiful white canvas here is draw the landmarks for intramuscular injections. So when you're giving injections into your horse, the neck's the safest area and usually the most common area. So your landmarks to know where to inject on the horse is you've got a bone along here. So this is the scapula. So this area here is a no-go zone. You also then have your nuchal ligament along the top here, and that has no blood supply in it or nerve or anything like that, and no muscle. So you don't want to put anything in that area. And then your third landmark is the cervical spine, and that basically comes down like this in the horse. So we've got, he's decided to move a bit, so we've got our cervical spine coming up like so, and then we've got the nuchal ligament. So this dodgy drawing here is what we class as our safe triangle. So anywhere in here is safe to inject in the horse. The only thing you'll hit is the other side of the neck. There's no bones or anything in there, just muscle. So this is the safest area to inject your horse. You just have to make sure with some drugs that you draw back and make sure you don't have any blood in before you inject, but this is the intramuscular injection site in the neck. There are two other areas on the horse that you can inject. One of the other areas is on the rump up here, and the landmarks for that are your point of your hip, which is just there, and then to the point of the tail. And if you draw a line across those two and then pop your palm in the middle, which is about there, so anywhere in that circle there is safe to inject. So they're your landmarks for intramuscular injection in the rump. Point of the hip, point of the tail, line between, palm in the middle, and then you can inject. He's very shy of his bottom and he doesn't want you to see his bottom. But that's the intramuscular injections in the rump. So the third area you can inject a horse for intramuscular is what we call the brisket or the breast muscles, which is just these two here. So you can inject in the centre of either of those. These have a higher chance of blood vessels, so you must be careful that you draw back and make sure you don't have blood in these muscles here. But they're quite muscular and you can put intramuscular injections in there as well. When you're doing the neck, it's the safest. You just make sure that you're away from the front legs. And if you're choosing the rump, make sure you're away from the kicking arc of a horse if they want to kick you. So you just have to stay in a safe zone in the rump here and make sure that you're out of the kicking arc. Because when a horse kicks, they will come forward and around. So you have to stay out of the arc of the kick zone. So if I'm wanting to do an intramuscular, I would stand here on this horse and just lean over to give the intramuscular injection there. Thanks guys.